My name's Mel Leviton. I'm the Executive Director of the Idaho State Independent Living Council.
Mel, how do you think the change from the Affordable Care Act to the American Health Care Act will affect the state of Idaho?
Well, that's actually a pretty long conversation that I know we don't have time for. So I will speak specifically to two areas. One being Medicaid, some of our waivers that we have, specifically home and community-based waivers for adults with disabilities. We have two of those waivers, the adult developmental disability waiver and then what we call the aged and disabled waiver. Those two waiver programs allow Idahoans with disabilities to continue to live in their communities and not in institutions, nursing homes, or just be stuck in their own home. For example, I know many people who use the home and community-based waiver, and they use it through what's called a Medicaid for Workers program, which is also a waiver. And they're able to work in their community, live in their own homes because they have supports to do that. And these are people who are paraplegics, quadriplegics, they have cerebral palsy, and they're able to get help getting out of bed, cleaning up in the morning, getting dressed in the morning, and able to get to work because of the supports that they have. Many of them pay in to be able to use that program, but they're able to access it and work and contribute to their community, pay taxes. Those programs would potentially go away under the American Health Care Act. Because it will go to something called per capita or block grants, either of those things would limit how much Medicaid money we get from the federal government, much more than what we have now. Right now, Idaho gets between 70 and 71% of our Medicaid dollars from the federal government. That's money that we all pay in taxes in order to help our neighbors be able to live better lives in their communities. So what that translates to is 70 to 71 cents for every dollar spent comes from federal tax money that we pay. Many states get a lower amount. By law, currently, states get at least 50% from the federal government. Idaho's is so high because our wages are low and our population is low. So that's why we get the larger amount. We hear people complain about the Medicaid program frequently, but one thing that's really great about our Medicaid programs is we don't have wait lists for people to get services, not adults, which is fantastic. So are there things to fix? Yes, but overall, it works pretty well in Idaho. So that would be a significant change, is that it would change that what we call the FMAP. It's the Federal Medical Assistance Percentage, from the 70 to 71 cents we get for every dollar down to perhaps even lower than 50, depending on how the law is impacted. The other thing that a lot of people don't understand is that these particular programs, the home and community-based services waivers, were not ever part of the Affordable Health Care Act. So the way the law is being written now, these caps are going to affect people that weren't part of the American Health Care Act. So these cuts in Medicaid, it's 840 to, I've heard, as much as 900 million in cuts over the next 10 years. So initially those cuts will happen pretty slow. One of the numbers I've seen thrown around is only about 3 million in the first year, and then the second year 18 million, and then it goes up exponentially over these 10 years. So these cuts will impact people over time, and that's really big. The other part of the American Health Care Act that we're concerned about is the potential to not provide insurance or allow people to as easily be insured if they have pre-existing conditions. That's really a big deal. Previously, before the Affordable Health Care Act, people who had a pre-existing condition had to apply to be in a high-risk pool. They couldn't get into a high-risk pool unless they had been denied coverage frequently, that most of the time actually, they weren't denied coverage. They were just offered coverage that was $800 or $900 a month, and and that's a little tough to pay if you're only making $1,200 a month. So they couldn't get into the high risk pool because they hadn't been denied. So that was a real problem. Once the Affordable Health Care Act came in, then people were able to get insurance that they could afford. Also, people don't seem to understand that this could even affect people who currently have insurance through their employers, because those policies will be rewritten. So you may not be able to get coverage for insulin if that's the policy that your employer buys into. So that's a big concern. It's also a concern, you know, an individual is employed, has insurance, loses their job for whatever reason, and they have 62 days under the American Health Care Act to get reinsured. If someone's come from very good insurance, purchasing COBRA can be, again, $800 or $900 a month. It's hard to do if you're on unemployment or you just get any job so that you have something. You know, if your income is only $1,500 a month, you can't pay that much for insurance. And then at a high deductible or high cost of medication, for instance, one of the very common medications used for multiple sclerosis is over $7,000 a month without insurance. How does somebody pay for that? It's just extremely difficult. So we have concerns on many different fronts. People not being able to get their home and community-based services as they've gotten. Something that the American or the Affordable Health Care Act didn't impact at all, but this is going to impact it. We're going to see people in the higher brackets get breaks, tax breaks the way it's written, and that's going to be done through the reduction of services to people who weren't impacted at all by the Affordable Health Care Act anyway, and that's really distressing. And people will then again be stuck in institutions, and we know that the cost of institutions can be up to $80,000 a year, whereas the cost of home and community-based services, the average is about $25,000 a year. Huge difference in cost, in money, and then huge difference in cost to human lives, and the adding the color to the community and to our families that people with disabilities do.